I thank you for coming today to hear about this really important topic. I'm Lorna McNeill. I'm an associate professor in the Department of Health Disparities Research at MD Anderson Cancer Center. Department of Health Disparities Research is unique in a cancer center. I believe at one point we were the only cancer center that had such a department. I'm really proud to work there and to talk to you today about a lot of the work that we do. Most people probably know that tobacco is a leading preventable cause of cancer. Dr. Pat did a wonderful overview of screening factors that impact late-stage diagnosis, as well as overall access to care among insured and uninsured. Today I'm going to talk about something that I think very few people may not know about, and maybe in this room that you do, but some other risk factors for cancer that are pretty important and have major disparities among minority populations. And that, in this case, is going to be talking about physical activity and obesity, which is my area of research. So there's a strong link between physical activity and obesity and cancer. As you can see on the slide, physical activity is associated with a decreased risk of postmenopausal breast cancer, colorectal cancer, endometrial cancer, and obesity is associated with at least 7 different types of cancer: gallbladder, kidney, colorectal, ovary, esophageal, postmenopausal breast, pancreatic, and endometrial cancer. And a lot of research is, going into trying to understand, some of the mechanisms for this and why this is, but it's really important to understand that as the obesity epidemic is on the rise, a lot of the advances that we've been seeing in cancer, cancer discovery and curing cancer, we may be reversing those trends as the obesity rate continues to increase. So we really do need to address this so that we don't halt our progress. It's estimated that about 120,000 cancer cases are caused every year by excess body fat, but yet 7 in 10 Americans are overweight or obese. And what I mentioned before, less than half of Americans are aware about the obesity cancer link. So I do a lot of work with African Americans and Latinos, and very few know that there's a link between obesity and physical inactivity and obesity. In terms of cancer prevention guidelines, like I mentioned before, we all probably have heard of these things. Stay away from tobacco. If you don't smoke, great. If you smoke, quit. Limit how much alcohol you drink. Eat a healthy diet with plenty of fruits and vegetables. Get moving with regular physical activity. Maintain a healthy weight throughout your life. Protect your skin. Know your family history, and get regular checkups. I think these are true for health in general, in particular for cancer. And today I'm going to talk about the two that are bolded: physical activity and maintaining a healthy weight. So just want you to know what the recommendations are for cancer prevention for physical activity and obesity. Adults should engage in 150 minutes of moderate intensity physical activity, or 75 minutes of vigorous physical activity every single week. And that moderate intensity is a level in which you're going to increase your heart rate, that it might be difficult for you to carry on a conversation. Children and adolescents should get 60 minutes of physical activity a day, and I'm going to talk about sort of the impact of taking physical education out of classrooms and how that's impacting obesity rates among our children, which is a growing epidemic. Limit sedentary behavior, such as sitting and lying down and watching television. And as a matter of fact, for mortality, they're finding that independent of your obesity status, sitting for too long of a time is detrimental to your health. So even if you run marathons, actually prolonged sitting, and most of us have office jobs, it's not good. So every chance that you can get, even now, if you want to, just walk around the room, it's always a good idea to get your body moving. It's going to have some health impacts. And any activity above your usual activity. There are lots of segment of America that are actually particularly sedentary. If you ask them, they don't even move for 10 minutes a day. So doing something above that is going to have some health benefits. The next one, achieving a healthy weight. Be as lean as possible throughout your life without being underweight. And in some cases, being overweight actually is protective, but most times obesity is never protective. Avoid excess weight gain. Losing weight has some health benefits, particularly for heart disease, which is actually the number one killer of Americans. And maintain energy balance, and that is the balance of energy in versus energy out. We have to balance how much food we intake and how much energy we expend. And so this slide is just talking about obesity trends. And just really quickly, the top one is in 1990. and the bottom one is 2010. So if you just look over the past 20 years, you can see the increase in obesity over time, where most of the country was in blue, which is less than 10% of Americans were obese, and now you can see most of us are in the redder shades, where some states, including Texas, greater than 30% of the population is obese. And I want to be clear that we're talking about obesity. If I included overweight, which is a category that comes right before, it's likely to be about 60% of the population is overweight and obese. But we focus on obesity because most of the evidence is there for it having more of a detrimental impact. Next slide. So one of the factors that I talked about is physical activity, and these are just showing some disparities in physical activity by race and ethnicity, and this is among Texans in 2012. And as you can see, whites have the highest rates of moderate or vigorous physical activity, and then the black bar is obesity, and whites also have the lowest rates of obesity, whereas African Americans and Hispanics have the highest rates of obesity, as well as the lowest rates of being physically active. The next slide is about educational attainment, and basically you'll see the same thing. As obesity goes down, as you get more education, physical activity increases the more you get education. So you can skip through the next couple of slides that are just talking more about the trends among obesity and physical activity among minorities, so that you can see the disparities. Next slide as well. So there's a complexity of factors that are involved, as individual factors, and I'm going to talk a little bit about factors in the environment, and particularly this obesogenic environment. So you can skip forward a couple of slides. And so basically the take-home point that I want to talk about is that environment has fostered more sedentary lifestyle and activities. We rely on cars more. We have the electronic entertainment, so no one gets up and turns on and off the TV anymore, right? We have remote controls. I remember when my dad used to always ask me to change the channel. TV doesn't go off anymore like it used to do at 2 o'clock in the morning. There's TV all the time. Or on Saturdays, you had to go outside and play because at noon there was no more cartoons. Now there's cartoons all the time. So when we look at these kinds of advances, which are great, we also realize that it's engineered physical activity out of our life. When we look at sort of the fast food nation, how everything is supersized. Or this is a cute slide of people going to the gym, but they're actually taking the escalator instead of the stairs. Next slide. In the social cultural environment, it has been impacted our ability to be physically active, and particularly among minorities. Social support for being physically active, such as family and friends who may be able to watch your children for you, or your social networks. There's some research that talks about obesity being contagious, that if your network is involved with other people who smoke, other people who are overweight, that's what behavior you're likely to adopt. Not that you need to drop those friends and get more lean friends, but to understand that your social networks do have an impact on you. The neighborhoods in which you live, whether or not neighbors know one another, has an impact. You're more likely to go outside and walk and engage in healthy behaviors if your neighbors know one another. I live in a subdivision, I have no idea who those people are. Whereas growing up, I knew everybody in my neighborhood, and we all can kind of have feelings like that. The neighborhood socioeconomic status. Poor neighborhoods are less likely to have health-promoting resources. Seeing people exercise, all of these things are cues to help us be more physically active. Move on to the next slide, please. Safety from crime and safety from traffic are really important. If you live in neighborhoods where there are no speed bumps, there are lots of traffic, there's lots of crime, you're not going to be physically active. The point being is, we tell people to go outside and walk, but you don't have neighborhoods that make it conducive to do so. Next slide. So would you rather walk here, someplace like this? Or would you rather walk here, which is where people actually live, right? People live here, and we tell them that you can do it, just get outside and go walking. But when they live in unsafe neighborhoods and live in conditions like that, they're less likely to do so. So last slide is just to talk about policy approaches that we need to activate in order to make healthier environments. Providing more healthy food options, providing recreational facilities, providing neighborhoods in which people can live and work and play. All of these kinds of things are helpful, in addition to providing opportunities at the workplace and schools for people to be active where they live and work is going to make it more conducive overall. Thank you.